I want to take this opportunity to welcome each and every one of you that have joined us for the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. And we have had the pleasure of meeting with you every Friday since March 20th of 2020. And by request, we're continuing to provide information for you that's relevant to the Flint community, Genesee County. And obviously, we're not talking about an issue that affects us only. This is a worldwide issue, but we're grateful that we have had in the last few weeks a number of community partners. So I am thankful as your moderator, Yvonne Lewis, to have had the pleasure of engaging all of our partners. Today, we are again at week 54. You can see, for those of you that are in the webinar, we've had a number of 45 plus partners who have joined us every week. And today in the webinar, as panelists, many of them are here to answer questions for you. Even though they have not been presenting every week, they are still in place to answer questions. So we want to encourage you, put your questions in the Q&A and be ready to hear the answers that are coming forth. We have a power-packed event session for you today. We're going to begin by looking at the questions about long haulers. We opened this conversation up to you last week, understanding long haulers. We're going to dig a little bit deeper into that. We're going to talk about vaccine rollout, vaccine availability and access, and of course, what we really want to understand too is an equity update. What's happening in terms of ensuring that everybody has access to the resources that are available. Our panelists today will be Dr. Deborah Fair-Holden, Dr. Susan Wolford, Dr. Lawrence Reynolds. Gary Jones will be presenting for us in just a few minutes. And then we'll also hear from our Genesee County Health Department representative. But I want to begin this conversation with you, Dr. Reynolds, today. This is a topic that we have been discussing for several years now about the Flint water crisis. And we know that there is a settlement coming up. So if you could allow us, Tricia, to just have this conversation with, go to full screen, we'll have this conversation with Dr. Larry Reynolds, who will give us a perspective on the lawsuit settlement. He's had raised some real important issues for us to consider. Dr. Reynolds.
Yes, and I must be clear. I have filed my objections as a claimant, just like everybody else in Flint. I am a claimant and I have my own attorney, and I'm also filing it based on the knowledge that I have as a Flintstone and as a pediatrician. And my main objection is the use of an industrial piece of equipment that emits radiation in order to measure lead that was not made for human beings. If you check with the manufacturer, they will tell you repeatedly, this is made for industrial purposes. So if you point this X-ray fluorescent gun at paint on a wall, it will tell you if there's lead in the paint. If you point it at a soil sample or some toy or some inanimate, non-living object, that's what it's made for, to tell you if there's lead or other types of metals in there, so that manufacturers can be assured of its safety and its purity. It was not made to point at human beings and give you an idea of lead in their bone. There are no standards for measurement. You know, when we have an exam or a test, there's a range of normal, and there's no agreed upon range of normal. And then I'll add, it's not part of a standard treatment protocol. So in other words, if you do this with the ray gun, it's part of a treatment plan that follows. No, because everything you must do, if this gun never existed, you still have to do afterward, which is if your child has behavioral problems, academic problems, cognitive problems, activity of daily living problems, you still have to go to someone to get help with that. If it's in the schools, it's the individualized education plan. If it's for the Neurodevelopmental Center of Excellence, it's so that they can have a total evaluation. None of that will be changed by this study. And there's no medication that we give, especially to children, in normal situations that will clear that lead. And we have focused on prevention, getting your house inspected, your soil inspected, getting your dust cleared, all these programs that exist to prevent our children from becoming walking, talking test tubes for lead poisoning. And we must insist on this. And then there's the other level. This is like this layers of protection again. In order to protect yourself against lead poisoning, you have to eat foods rich in iron, calcium, vitamin C, which will promote absorption, because these things compete with lead so that you can absorb the things from a healthy diet that you need. I'll take a breath.
Yeah, so Dr. Reynolds, this is important. I know we've been talking about coronavirus, but the Flint water crisis has been with us. It predates Corona, and yet we're still faced with many other challenges as a result of the water crisis. And so you mentioned that you are you're a litigant. You filed your own suit. You got a lawyer. Is it important, though, for others who may not have that background that they need to continue to complete the registration form for the current lawsuit case that is available?
Most definitely. I recommend that you register and connect with an attorney, but I also advise you be careful what you consent to, because the place where this X-ray study is being done is run by an attorney who lives out of town. It's under the direction of a physicist who lives out of town, and the physicist deals with radiation, and it's run by a medical director who lives out of town. Okay, so I have yet to find licenses for some of the people involved in this in the state of Michigan, and I might add in their home state, and that might be an error on my part, but I have yet to find that the equipment was registered until I filed my objections. Then suddenly this equipment, which I have been led to believe has been used for months on hundreds, if not thousands of Flint residents, was not registered with the state, which is illegal. So, and then are you being completely informed that this equipment is not for human beings? So when it comes to, do you want the bone scan? You might get more money if you have it and it's positive. Think again. Do you really need it? Do you want to subject yourself and your child to unnecessary radiation? That would be like going to the dentist and he says, let me just take an x-ray of your teeth. Or walking into a doctor's office and they say, let me just take a chest x-ray.
Thank you, Dr. Reynolds. One of the things for the Healthy Flint Research Coordinating Center is to be sure we help provide information for our community about various research projects, and are they actually the best for community? The important things that we're able to make an informed decision. So we thank you for that information today. I want to just make sure
hold up. You said this was research. The lawyer says this is not research. This is a service.
Right. You about to get me in. You about to get me in trouble, Dr. Reynolds.
Right. If it looks like a duck, walks like a duck, and quacks like a duck, it is research without the protections that we have under all the rules and regulations by federal, state, and state government and the universities and real research centers.
And I got to jump in for 1 second. You're going to kill me, Yvonne, because it's a sleight of hand. Because what I can guarantee you is going to happen is once all this data is collected and people have been seduced into exposing themselves and their children to this unnecessary exposure through this industrial piece of equipment, the researchers will then run in. Guarantee you they're on the bench just waiting for all of this data to be collected. But because they're not out on the front line, they'll say they had no hand in the data collection, and they'll be then able to take all of this data and turn it into research after the fact. It's a quite insidious loop and web that's being weaved. And Dr. Reynolds is out at the forefront trying to stop it. So Dr. Reynolds, I'm in the fight with you.
Thank you,
I'm on the team.
Thank you. Thank you. And I wish that there were researchers who would speak up stronger. That would help an awful lot. You know, I filed with the state and I got an answer back on one aspect. Oh, you need to file with this other agency. And I went to the other agency site and it said it may be weeks before you get a response. But the exposure using this equipment is ongoing as we speak. So here we go again. We must maintain trust. And that's what makes the Healthy Flint Research Coordinating Committee and CBOP so important, because we hold people accountable.
Well, now, Dr. Reynolds and Dr. Deborah, you all have raised some questions for our listeners today, and so the question is, and I think you've answered it, Dr. Reynolds. As far as we know, there's not been any IRB approval because they're saying it's not research. But when we are looking at it more closely, as you said, Dr. Deborah, there's some reason to believe that there needs to be some more work done on this. So, Dr. Reynolds, we thank you for being out here, and we want our listeners to know. Our goal is to make sure you're making an informed decision. So if you have not completed the water settlement registration, and it's an online registration. If you haven't seen the packet in the mail, it's the official flintwatersettlement.com, the official watersettlement.com. Right now, the date is March 29th, only a couple days away. So we do need to encourage you to make sure you've done what you need to do to be considered. Because again, Dr. Reynolds, I know we're not lawyers here today, but it's my understanding that if people don't complete the registration now, they may not have opportunity in the future.
That's right. But you have the right to refuse certain procedures, and you should be clear on that when you register and an attorney calls.
And I will say this, and Yvonne, you're going to kick me because I didn't get permission to speak. But while it may not be technically research because of how they're rolling it out, it is experimental. The use of this device in humans is experimental. And like I said, these are my people. Researchers, those are my people. I understand. They are on the sideline, on their toes, waiting for all of this to be collected, doing whatever they're doing in the background, but keeping their hand right out of the pot. Because the second you put a researcher's hand in the pot, they say it's research. Or the researcher then is not able to get IRB approval after the fact. It's not good stewardship and responsible conduct of research to be involved in the collection of data without going through an institutional review board or an IRB. So they're purposely on the sidelines, on their toes, without their hand in the pot, because once the data is collected, they can then get an IRB to play with the data. Yeah. But they're not being responsible and running it through an IRB right now, knowing that's their plan, so that all of the protections that an IRB provides are put in place. And so I'm gonna predict it and say it right here. As soon as the data is collected, everybody who submits is going to start getting, and there might even be some little caveat when you agree to the scan, real bottom, small fine print that says, you're agreeing to let your data be used for research purposes one day, someday in the future, which will be 15 seconds after that data is collected and used for the purposes of the settlement. I'm telling you, that's what's happening.
And be careful for some of those consents, because it says that the person operating the gun, in charge of operating that gun, owns the data. You do not own your own data. And the reason I got on this is because a mom called and said she had the test and she wanted to go over her results, and all she got was music. And I called the same day, and that's all I got on the 800 number was music.
Thank you, Dr. Reynolds and Dr. Holden. So for those of you that are listening today and you may be reviewing this at a later time, we're encouraging you to read carefully, ask questions. And there are some questions in the queue, so I'm gonna ask the panel if you can answer those questions so that all the participants can see the answers. But one of the one of the important things is that we want our community to be able to make an informed decision. So we'll continue to talk about these issues as we move forward, but really want you, when you look at your documentation, ask questions so that you can be clear about what you're engaging in. So thank you, Dr. Reynolds. Thank you, Dr. Deborah. And we'll move on now to Gary Jones. Gary is a representative of the governor's office here to provide us with an update. Gary.
Yeah, thank you, Yvonne, and good afternoon, everyone. So in early April, FEMA will begin providing financial assistance for funeral expenses incurred after January 20th, 2020 of last year for deaths related to COVID-19 to help ease some of the financial stress and burden caused by the pandemic. The policy was finalized recently, and FEMA is now moving rapidly to implement this funeral assistance program nationwide. Also, the governor and the Department of Insurance and Financial Services Director, Anita Fox, are recently applauding the Biden administration for extending the current health insurance marketplace special enrollment period through August 15th. This decision, along with increasing subsidies included in the American Rescue Plan, will make marketplace health coverage more affordable and more accessible for Michiganders struggling with the economic effects of COVID-19. The governor also recently secured bipartisan support to give Michiganders more time to file individual state income tax returns. So the state of Michigan individual income tax annual returns are now due on May 17th, 2021, according to a recent announcement by the Michigan Department of Treasury. Recently, MDHHS updated its gatherings and mass epidemic order. This update also increases testing for youth ages 13 through 19 to ensure athletes can safely participate in sports. These changes went into effect Monday, March 22nd, earlier in the week, and will remain in effect through Monday, April 19th. And lastly, registration is open for the COVID-19 vaccine clinic at Ford Field in Detroit. The community vaccination site will be offered the vaccine will be offered at no cost, and insurance is not required, nor will it be requested at the vaccination center. Any Michigander, any Michigan resident who is currently eligible to receive the vaccine under the MDHHS prioritization guidance will be able to register for an appointment. And lastly, I always like to plug the catch-all website, michigan.gov/COVID vaccine, for all information related to COVID vaccine in the state of Michigan. And michigan.gov/coronavirus is still the best catch-all website for anything related to COVID-19.
Thank you. Thank you so much, Gary. You made two incredibly important points. You talk about the special enrollment period. We will have some more information about what is available here in Genesee County regarding that, because there are some really important things that I think people will want to know about how those premiums will be reduced. And later in this segment today, we're going to talk about vaccine rollout, some exciting things that are happening here in Flint, Genesee County. So thank you, Gary, for that update from the governor's office, which really helps us to know how we can make a difference here in our local community. We now want to have a quick conversation about this long haulers. We talked about that last week. Dr. Wolford introduced that concept to us. So she's going to give us a little bit more about that, because we want to end our segment today talking a little bit more about the vaccines. So Dr. Wolford, help us to get some more insights on this long haulers conversation.
Thank you so much, Yvonne, for this opportunity to continue that conversation. So we will be talking a little bit about long haulers, or as it's often called as well, long COVID. And I want to point out that having post-symptoms, having symptoms after an acute viral infection is not sort of unusual. I don't know how many of you may have had glandular fever as a child, mono, kissing disease, as it's called. And you had the acute sore throat and you felt really sick. And then there was that period of feeling tired afterwards that many people get. So having that sickness after the acute illness has been seen in viruses before, but with COVID, as with everything else, it just seems to be a lot more dramatic than has been seen in many other cases. So if we go to the next slide, we know, looking at the data yesterday on the Michigan.gov website, about over 700,000 people in Michigan have had COVID. and tragically 2.4% died. But what about those who survive? What can happen to them? And as I mentioned last week, we're learning so much more about this as time progresses, right? Because as with everything else with COVID, it's an emerging experience. And so we don't know all the answers. So just this week, a study came out. It actually hasn't even been peer reviewed or published yet, but the post-hospitalization COVID-19 study published their results or released their results. And from their data, it showed that 7 out of 10 patients who were hospitalized with COVID may go on to get long COVID, i.e. they have symptoms more than, well, the CDC says more than 28 days after they had the infection. It was saying that 7 out of 10 had symptoms 5 months after they were diagnosed. So clearly this is going to impact huge numbers of people. And I want to emphasize, it is a reason to, if you needed another reason, to get the vaccine so that you are less likely to end up with these kinds of symptoms. So what are the symptoms that we see? Well, we see mainly people talk about the fatigue and tiredness that they have. They also have sort of a persistent cough, and then they can also have a low-grade fever that kind of continues. But these are just a couple of the things. Really, the symptoms are myriad. And if we keep going, we'll see that you can have any number of symptoms. It affects breathing, it affects headaches, muscle aches, memory loss. People have difficulty focusing. It has just this devastating effect to a wide area of pretty much every organ system. If you remember, I said last week, it affects our brain, it affects our breathing, it affects our body aches, all the B's, and it can give you the blues, make you depressed as well, or is associated with depression. So who gets COVID? Who gets long COVID? Well, it's important to note that while those who are hospitalized may be more likely to get it, pretty much anybody can get it. It doesn't even matter if you had a mild illness, you can also get it. And so the CDC has this flyer where they note that 1 in 5 previously healthy young adults, so this isn't just everybody, this is not the elderly population, 1 in 5 previously healthy young adults were not back to normal after 14 to 21 days. So this is something that can affect pretty much anybody. Well, though the data show, at least for those who are hospitalized, that women are more likely to get it, and those in the middle years are more likely to get it as well. That makes me very nervous. Okay, on to the next slide. So we're noticing that this is a problem. It's being covered in the media. And the question is, will one ever get better? Well, we don't really know. Some do, but for some, it is still continuing several months, a year after being first diagnosed with COVID-19. And it's acting very much like chronic fatigue syndrome. And so scientists are trying to learn from the chronic fatigue literature to try to see if that will help. One thing that may help, and I say may because again, we're learning, is resting. Actually taking the time it takes for your body to heal. Just rest as much as you can, and maybe that will make a difference. So what's causing it? Again, we don't really know. But one thing we do know, we can go on to the next slide, is that lung damage plays a major part here. And we can see the scarring in the lungs. And so we believe that that is a lot to do with what's impacting these symptoms. And that scarring is either directly from the COVID virus itself or from the body's immune response to it. But all of this is things that people are studying. As well as the lungs, I also want to mention the brain, because that is an area where we're seeing it's impacted as well. And COVID itself, do one more click, will damage, has been shown to damage some of the blood vessels in the brain. But also it could be the immune response as well. Again, not sure. It could also be because maybe there isn't enough of an immune response, and sort of the virus is doesn't really go away well. All of these things yet to be studied about COVID-19. And so one final thing I'd like to mention about it, because it's still being studied, if you, there are lots of lots of research studies about it, and you could participate. So there's an app for everything, and there's a symptom tracker app. And this symptom tracker app has now been used to predict, next slide, who gets COVID, long COVID. So if you happen to get COVID, one of the things you might want to do is to sign up for this app, and thereby you'll be able to help provide information which will help them work out who is most at risk for getting long COVID, and hopefully be able to help people address this and recover from it. So there's a more in-depth look at long COVID, Yvonne. I hope that was helpful.
Thank you, Dr. Susan. And before you go away, just one quick question. You mentioned in your comments, in your presentation, that there is a lot of research already going on, and we talked about research. And so with this app you're talking about, do people need to understand that there's an informed consent process that goes along with this, and it is a form of research?
So this is clearly research, and this group appears to be very open with the fact that it's research, very ethical about the way they're doing it. The Francis Collins, the head of the NIH, tweeted about it. I do believe that it's one of the systems whereby they're very open, and you put your data in there that you would like to have in there. You share about your symptoms with the understanding that you're doing this in order to help science. So it is clearly, yes, it is, I think, above board in the way that it's addressing this. And it's a way that we as citizens can help in the process of trying to understand this very, very devastating illness.
Thank you, Dr. Wolford. And it does feel like we talked about this too last week, that we're all a part of a huge experiment, huge research effort with COVID. And so we really want to be careful. We want to be mindful and make the best decisions in this. As was mentioned earlier, there's a lot of information. There are a lot of things going on. We want to be mindful. We want to be careful and ask somebody for information if you should need it. So please put those questions in the queue. We'll be happy to do our best to answer them for you. One of the other things we want to talk about today is this huge opportunity that's coming forward with vaccine rollout. We're appreciative of having Matt Peters here. Sherelle Brown was scheduled to be our presenter today and had unfortunately had to be away at a funeral. So we're appreciative of having Matt to step in. Matt, would you please give us the update from the health department, and welcome as a first timer for the webinar.
Absolutely. Thank you, Yvonne, for having me on. Hopefully I can live up to the high standard that Sherelle sets. So hi, my name is Matt. I'm an epidemiologist here at the County Health Department. I'm here to just give a little update, mostly on how our vaccine rollout is going. So as of March 23rd, we've vaccinated over a quarter of Genesee County's population. Us and our partners at pharmacies and our subrecipient partners throughout the county, we've been able to vaccinate over a quarter of the population. This is obviously very exciting that we've been able to get this far, and we are really appreciative of everyone who's been involved so far, and particularly the patience that everybody's had. You know, I know at first it was a bit slow going to start off, but we're hopefully going to be able to ramp up our rollout, and we have actually over the last couple of weeks. So right now, we've been able to expand our rollout. We get more and more vaccine every week, and it's become a lot more widely available within Genesee County. Recently, we received our first shipment of Johnson & Johnson. So we're excited to have that option as well. Both Johnson & Johnson and Moderna are approved for people who are 18 or older, and the Pfizer vaccine is approved for those who are 16 and up. So again, throughout the county, we're just putting a lot more effort into trying to get shots in arms. And specifically with the Johnson & Johnson, although we've received a little bit of it, unfortunately, we haven't received enough to the point where we can receive requests specifically for Johnson & Johnson. I know some people have expressed interest in that vaccine because it is one shot, but we're still looking to get more of that. Right now, we're using it to focus on specific populations, but as things move on and as our rollout progresses, hopefully we'll have more of that available as well. So when it comes to pre-registration, as of this past Monday, the state did expand the eligibility for folks getting vaccinated. So as of now, as it stands, we are currently vaccinating folks who are in phase 1A, which includes healthcare workers, long-term care residents and long-term care residents and staff. Phase 1B, which includes frontline responders, teachers, and school staff, and 65 plus individuals. We are also vaccinating caretakers and guardians of children with special healthcare needs. And now we are vaccinating anybody who is aged 50 and up. So whether or not you have any pre-existing conditions or risk factors for COVID, if you're age 50 or older, you can sign up to get vaccinated. And we are also vaccinating anybody age 16 through 49 who has a pre-existing condition or underlying medical condition that may be a risk factor for COVID. And this includes a wide variety of conditions, including things like obesity, diabetes, asthma. So if you have any sort of condition that might fall under this broad umbrella, we encourage you to sign up to get vaccinated if you're aged 16 through 49. And if you're 50 or older or 65 or older, we're still vaccinating you too. So if you haven't gotten the chance to get vaccinated yet and you're an older individual, we encourage you to keep signing up, keep contacting the health department, seek out your local pharmacies too, as they're also receiving vaccination. So, as our rollout continues into the future, we're going to start including people who are aged 16 to 49 who do not have a underlying condition of some sort. And this is the schedule for our pre-registration, which you may find at our website, gchd.us. Starting March 25th, which was yesterday, those who are aged 40 to 49, regardless of health status, could sign up for pre-registration. Starting on March 29th, that goes down to 30 to 39. April 1st, age 23 to 29. And finally, April 5th, if you're age 16 to 22, regardless of your health status, you can sign up for pre-registration. What this means is that by April 5th, we will be trying to vaccinate everybody who is aged 16 or older, regardless of any pre-existing conditions. So we've been able to establish some vaccine clinics. Right now, we're just doing appointment only, but we have dedicated clinics at a couple different locations, including Flint Northwestern High School, Bishop Airport, several of our faith partners at Our Lady of Guadalupe, Central Church of the Nazarene, and Shiloh Missionary Baptist. We also have set up a site at the North Bank Center at U of M Flint, and hopefully soon we'll have a site at Mott Community College. So as we continue our vaccine rollout, we'll have these sites available, and hopefully we'll be able to cater to some individual needs depending on availability. We'd like that you can hopefully choose a center that's close to you and convenient for you in the future. So as we've said before, you can pre-register to receive your vaccination if you haven't had the chance to yet. You can find that link both at gchd.us or gc4me.com. And as of this week, we have finally been able to set up our COVID call center. That is a number that you can call to become registered for your vaccination, or if you have any questions regarding vaccination or COVID in general, you can call 810-344-4800, and you'll reach somebody at the health department. I know now that it's been pretty busy so far, so you might be on hold for a little bit, but we are adding more and more people to that call center so we can reach as many people as possible. But yes, any questions you have directed towards the health department, you can call that number. And then as was added in the chat, you can also call our old hotline, which is 810-424-4443. Again, that Also, we'll get you in touch with somebody at the health department. And just a quick addendum here for cases. We've recognized in the last couple weeks that our case totals have been rising in the county. Obviously, this is something we want to keep an eye on here at the health department. But specifically in the last week or so, we've seen that a number of cases is rising, and this increase is often occurring in people aged 40 or under. That is partially due to the fact that things are opening up again. People are back at school, restaurants are opening up, and we at the health department do just want to urge people to do what we know works when it comes to preventing illness and preventing COVID. Vaccination is obviously very helpful in this regard, but it's not a perfect plan to prevent 100% of illnesses. So regardless of whether you're vaccinated or not, we encourage you to continue practicing safe, just practicing safe practices, doing your social distancing, wearing your mask, washing your hands. And I know that we've gotten some hope with the vaccines, and it's very exciting, but we have to stay diligent throughout the however long this unfortunate pandemic exists for. And I also like to remind everybody that all of our testing sites, all of our community testing sites are still open. Testing is a very important piece of understanding the nature of COVID. And so if you know that you've been exposed to somebody who has COVID, or if you're feeling somewhat symptomatic, you can go to any of our community testing sites and get tested and know for sure. And that way we can take the proper precautions to prevent spreading the illness even further. But so far, everyone's been doing a good job. We just want to make sure we keep that case count under control. But like I said, there's definitely a light at the end of the tunnel with our vaccine rollout process. It's just takes a little bit longer than one might hope. But again, you can head to any of these testing sites if you'd like to get tested for COVID. So thanks once again for having me on. Appreciate it.
Matthew, I just have one other question for you, because you did mention that 16 and older is going to be up, but all the vaccines are not for 16 and older, for that 16-year-old group. So can you just clarify which vaccine for the 16-year-olds?
Yeah, that's right. So Pfizer is currently approved to vaccinate those 16 and older, Pfizer specifically. Moderna and Johnson & Johnson are only for 18 and older. So if you are between the ages of 16 and 18 and you'd like to get vaccinated, you should try to seek out a Pfizer vaccine.
Okay. Thank you so much, Matthew. And I know the health department is doing a great deal to help get vaccinated, but we also have our partner here, Clarence Pierce from Hamilton Community Health Network. And Clarence is going to tell us about some of the things that are happening over at Hamilton. Clarence.
Yes, thank you, Sister Yvonne. It's good to be with you today. We are running a special clinic today over at the 812 Root Street Center of Hope site. I'm happy to say that we had quite a crowd over there this morning. Mm-hmm. I did check just before coming on the program, and we had about 190 doses. So far, we have actually used about 130 of those doses, and we will certainly run out, I'm sure. We have a walk-up as well as drive-through. And this was a special clinic that we ran today, but we provide vaccinations at 3 of our locations, drive-through, at both our North Point location on the north end of Flint, our main site there, 2900 North Saginaw, and in Burton at our Burton site, and that's located at the fire station in Burton. And we run those clinics on Monday at Maine, on Wednesday at North Point, and Fridays at Burton. So anyone can drive through, just go on the website, register, and we will get you in for the vaccine. We also do in-clinic vaccinations. So you can also pre-register for that. And we're hopeful that we're going to be able to vaccinate a lot more people coming up here in the near future. Like Matt said with the health department, we have the same policy and the same guidelines in terms of who gets the vaccine and the age groups that are eligible for the vaccines. And in the coming few weeks, we expect to see a lot more people and to vaccinate a lot more people. Our only obstacle right now is, of course, getting enough vaccine to make sure that we can cover everyone who wants the vaccine. So we're excited about it. We also did receive some additional funding from HRSA to help us vaccinate more people, and that will certainly give us the ability to reach out and make sure that we can vaccinate anyone who wants to be vaccinated. So thank you, Yvonne.
Thank you so much, Clarence. And I think, coupled with what the health department is doing, and certainly we thank you all for working together to ensure that all the members of our community who are interested in getting the vaccine have that opportunity. So when we talk about vaccine accessibility, to make sure that it's available and that we can access it, and then the availability. We know that we're looking for more vaccines that are coming into our community. And so we want to encourage you, if you're listening today, Matt, I want to say that someone told me they tried that 344 number and it worked. And that's the other thing, we want to make sure that these things work. So we appreciate that. It did work. And so opening up to more people in our community is really, really important. That's where we get to this whole equity conversation. And Dr. Deborah is our leader in mandating equity. And so Dr. Deborah, help us, kind of summarize all of this from an equity perspective. We know that vaccines are available and accessible, but we really want to make sure that everybody has that opportunity.
Yeah, great. Thanks, Yvonne. So I keep talking about mandate equity. I want to just let people know what that is and what that means. We're launching specifically around COVID equity, but it's more than that. So I love this graphic. I want to acknowledge my great communications person, Jill Vondrasek, who made this for me. And we've decided that the two guys on the other side, that's a Deborah Verholden in the middle, and that's a Jim Milanowski and a Luther Evans on either side of me, because to me that very much reflects my community and the people that we're working with. And you can see here we are pushing this boulder uphill, right? And originally the graphic was us pushing a boulder uphill, and that is my experience of what's happening in community. A lot of really smart, really brilliant, hardworking people pushing really hard for equity. So what we're asking for is, and that's a representation of President Biden with a rope wrapped around that boulder, helping to pull that boulder uphill. So what mandate equity is about is using legislative power and other authority to ensure racial equity. So what we're trying to do is get some legislative pull for all of the community push, right? And so that's the movement. You can check it out, www.mandateequity.org. Right now we have an open letter out to President Biden asking him to put legislation in place requiring equity in COVID vaccine distribution and administration. But this is a movement, and it applies for so many things beyond COVID. So how are we doing in Flint and Genesee County? Well, got to sound the alarm for folks. Our community case rate has more than doubled from last week. We're hitting those numbers now where we were at the height of this epidemic. Our community case rate, if you go back a month ago, was 2.9%. Last week it was 5.8. 2 weeks ago it was 5.8. Last week it was 9. This week it's 11.7. So we've doubled our case rate. So testing remains pretty robust, and Matthew spoke about that a little bit. But among those people that are getting tested, more people are, a greater percentage of them are coming up positive. So that's our signal that we've got more spread in the community. And I think that spread is attributable to a couple of things. One, we had reopening, right? Anytime you reopen, you get more people coming in contact with one another. And that's the way viruses work. More people come in contact with each other, you run more risk of spread. Clearly, we're going to have to get back to some space where people are moving out and about and re-engaged in our world, whether it be at work or at school or at the park or at the bowling alley or the gym. So I'm not, advocating that things never reopen, but we can expect as things reopen, including schools, that you will see an increase in spread. And that is exactly what has happened. So the question is, how do we counterbalance that? When you look at the data, we've seen a significant rise in positive cases attributable to the 0 to 19 age group. And I'll show you specifically what that looks like in a minute broken down. These trends are very consistent with what we're seeing in the state. And like, not a big surprise, kids are back in school. Kids are back re-engaged in sports. There was this myth early in the pandemic that kids can't get COVID or kids can't spread COVID. That is a myth. Not only have we figured out that not only do kids contract and spread, but we've had pediatric deaths from COVID, and we've had kids who've contracted COVID and had consequences and complications. And now we're starting to see what Dr. Wolford talked about with the long COVID or the long haulers. We've got some children that seem to be in that category. So I just want people to really understand it's important now more than ever that we honor the protocols and we practice prevention. The vaccine does really good at preventing people from getting sick and preventing death. It doesn't ensure 100% protection from spread. And until we're all vaccinated or some significant proportion of the population is vaccinated, if people take their foot off the gas and relax too far, we're going to see that number start to go up. And that number is getting dangerously close to the point where guess what's coming again? Everything will be closed down. We are literally sealing the fate for summer. And it will be a summer that is more restricted than the one we had last year. So let's save summer. Everybody do your part. This is what the actual numbers look like. Still managing this issue around unknown cases, et cetera. We've talked about that before. This is something we're going to have to keep attending to. We have a huge groundswell in Michigan and in Genesee County to not continue to kick the can down the road of unacceptable missing data around race. We want to deal with racial inequity, and we need the data to do that. So we're still working on it. As you can see, the trend in Flint increasing, the trend in Genesee County increase. And so let's do our part, because what I'd love to see in the future weeks is those bars start to go down. Next slide, please. All right, so we have a graphic. I'm going to break it down for you for the younger versus the older children, because we say 0 to 19. And, you know, we've been working very closely, myself, Dr. Reynolds, Dr. Reyes, Eileen Tomasi, with Superintendent Stewart, who came on last week to give us the good news about our kids going back. We've created some metrics for what that will look like. And now we've crossed that threshold, that sweet spot of where we thought we could do it safely. This is what it looks like. If you look at the purple line, that's the 0 to 12. So these are our infants, our toddlers, and our 0 to 6th graders. And then when you start to look at the older kids, you know, and older kids have more autonomy. They move around a lot more. They're engaged in sports. You know, they've got some of them the size and body of adults, but not quite the decision-making processes and cognitive abilities. You can see the rate is going up. Not the rate, I'm sorry, the absolute number of cases is going up much faster in that 13 to 19-year-old age group. So again, I'm asking trusted adults in the community and parents to really reinforce this messaging with kids. The vaccine will be available to them very soon, but it's also important that they understand the power of prevention right now. All right, I think it's almost time for me to hand it over to my wonderful colleague and generator of our health equity brief, Mary Catherine Crawford. I'm going to hand it over to you, Mary Catherine.
Okay, thanks, Doc. So if you have any questions about the report, you can shoot me an email at Croft, that's CRAWF 457 at msu.edu. If you have any questions about the data that Doc just broke down, please contact my wonderful colleague, Rick Sadler at sadlerr at msu.edu. So let's just dive right into policy recommendations. Michigan has the second highest number of the more transmissible COVID variant from the UK, B117. And we've seen how quickly this variant became the more dominant strain in the UK. So our policymakers at every level must be ready to respond with evidence-based public health measures. And that ties into what Doc was saying, that we will be headed back into a lockdown and save summer. So the second thing I want to talk about is the legislature recently passed an extension of the Paycheck Protection Program. So we're asking our policymakers to work with the Small Business Association and other groups to ensure that this next round of funding that is coming is distributed equitably. And this means acknowledging that we need significant reforms to the rules and regulations that impact businesses' ability to receive and apply for this funding. And while we're on the subject of funding, it leads me to what we're going to talk about next. It's that it's time for Republican lawmakers to allocate the $841 million to K-12 schools. This funding is being withheld in Lansing due to political meddling. And our schools need every dollar to keep children safe, especially when the health and well-being of our children and teachers is at stake. And the data shows that youths are driving cases up, and what we know that children are at stake for being long haulers. And so all this is doing is harming children. And so this is one reason why policymakers also need to continue paying for and distributing rapid tests to schools in sports schools because of sports teams and activities as restrictions are continually lifted. And Gary addressed this, and we thank you for addressing this, Gary, and we definitely certainly stand behind that and thank the administration for that decision. So the last thing I'm going to talk about is our ask to Michigan congressional senators to co-sponsor the For the People Act of 2021. So part of this law addresses voter access, including pieces such as expanding the ability to vote by mail or even registering to vote on the same day of a federal election, which isn't legal in all states or allowable in all states. So in many ways, it protects every American's right and access to vote, which is related to health equity. So then I'll just transition to what we can do as community members on our next slide. So as usual, please go to, it's gchd.us/COVID-19 volunteer /, and you can find the pre-registration form to find out what you can do to help on a local level. You can also download the free My COVID Alert app to get alerts and find out if you've had a potential exposure to COVID. And lastly, as Michigan continues with its robust vaccine rollout, you can help just by offering to sign people up for appointments, help equip people by sending them the links, the phone numbers to get them signed up. And you can even volunteer or work for a call center, offer rides to get people there, do what you can do, just do it safely using the layers of protection that we've been using. That's it. Thank you.
Thank you, Mary Catherine and Dr. Verholden on the mandate, equity, and the policy update. It's so important that all of us remember how important our voice is. Your voice counts. And as a result of your voice, we've been able to do some incredible things. And one of those is to provide continuing education units for our community health workers. This is a result of your direct participation in the webinar and asking how this could be possible. And so for your voice, we now have the community webinar CEUs available for any community health worker. Then we were also able to, in partner with Michigan State University, provide continuing education units for social workers. And this is really, really important. I want to just remind those of you that are social workers, and if you know someone that could find value in this opportunity, is that immediately following the webinar, there will be a pop-up Qualtrics survey for you to complete. And then you will be emailed a link directly from Michigan State University within 7 days of receiving, within 7 days. You must complete the link within 7 days of receiving the survey. A certificate will be automatically generated for you, so you can be looking for that. And then you must download and save it to print it for your records. But we do want you to be encouraged to follow the process that's been established for you to receive those continuing education units, those credits, so that you can benefit from your participation in this webinar. It is extremely important. Is extremely important. So thank you to those of you that helped us to do this. And we look forward to your continual feedback. We have something exciting for you. And I'm going to ask Dr. Deborah if she'd come back to talk about this with me for a little bit, because we know that even during the Christmas and New Year holiday, the holidays fell on a Friday. So we had to do something a little bit special. And we've got something special coming up, because this Friday coming, week 55, is actually Good Friday. And we know many want to honor that special day, but based on their faith tradition. So what do we got planned, Dr. Deborah, for?
And we even had some questions that came up in the Q&A specifically that we're going to answer. So Friday has caught us this year. Friday caught us for Christmas. It caught us for New Year's. And we got creative because we want to make sure that we don't miss a week. So we're going to do what we did for Christmas and New Year's, and we're going to do it on Saturday. We're going to allow everybody to honor Good Friday and have the Good Friday of their choosing without feeling like they're going to miss it or miss the chance to interact with us. So instead of doing the classic webinar, we're going live. This is exactly what we did on Christmas and New Year's. So consider this your post Good Friday good news. We're going to have some good news on Friday, because it's going to be good information from people that you all know and people that you can trust. We've got our Flint's pediatrician, Dr. Reynolds, is coming on. We've got Dr. Jennifer Edwards Johnson, our new community dean at the MSU Flint campus, who also will be practicing at McLaren Hospital beginning in July. We've confirmed Dr. Omari Young, who is a legacy of Flint's OBGYN. His dad was an OBGYN. He's an OBGYN. They got their sleeves rolled up. They're ready to answer the questions that you have about the virus and the vaccine for women who are considering becoming pregnant, pregnant moms, lactating moms, and children. Y'all asked, we got it. We got a family medicine physician, pediatrician, and OBGYN all right here from our community. And if you have any questions about distribution, administration, what new sites, why can't I go here? We also got our just simply amazing new health officer who wears the double hat of also being the chief medical officer for the Genesee County Health Department. Dr. Pamela Hackert will be on. So we got the all-star dream team lined up on Saturday, April 3rd, right after Good Friday, to really roll up our sleeves and unpack these questions that people have had that we have not had the answer to. And it's really relevant because now what's happening is they're going to start clinical trials testing on the vaccine in children. So we've got the people, and you want to understand, they're having to do some more research themselves, reaching out to their professional societies, going and looking at some of that data so they can literally give us the best and the latest and the greatest. So y'all think I'm, Flint's Dr. Fauci? We got a whole lot of, I think he might be the nation's Dr. Deborah. Maybe not, I don't know. But we got the best in the nation right here in our own city who care and will be there on Saturday. And of course, we got our fabulous moderator, Yvonne Lewis. I'll be in the background, but I'll be there, but in the background.
Thank you. Thank you so much, Dr. Deb. And it is really incredibly important to note that many of these individuals that are coming forward, they're volunteering, they're making it happen. They're going to use their own private time. We work during the week, but they're willing to come in on a Saturday. So we invite you and encourage you, if you know somebody, because they're working on Friday, they can't join the webinar, they can still follow us on Facebook. They can still get the information. They can go back and review the YouTubes. So for those of you that are listening, help us get this word out. The information that's being shared here is so relevant to what we're doing every day. We appreciate you, community health workers, and all of you social workers, wherever you are, navigators working in this community. We're providing this information on this platform, but it's you who takes this information out and shares it with the individuals that you come in contact with every day. We appreciate your questions and ask you to continue to bring those questions in and share them with us, because it is you that helps us to make a difference. Again, one more time, social workers, right immediately following this, look for that link to fill out so that you can get the information you need for your social work credits. Again, let me say, like us on Facebook, subscribe to our Healthy Flint YouTube channel. email us at info@hfrcc.org or give us a call at 810-835-2130. And every week we'll be here until you say differently to give you this information. I see your hand, Dr. Deborah. And I also want to say, we've got some millennials working on this issue that Dr. Reynolds raised. So if you're interested, stay tuned. There's more to come on the Flint water settlement as well. Dr. Deborah.
For our live on Saturday, April 3rd, we're going to put up a flyer on our Facebook page. If you like and subscribe to the Facebook page, you'll automatically get notified. It'll be live streaming minimally on our Facebook and on our YouTube channel, and other people are free to share about it. Anybody who's participated in the webinar, you will get a special email invitation to join the live on Saturday at noon. So people don't have to do anything. If you've ever been here, you're going to get notified, and I ask that people share it. This is the stuff that people been asking about, and we got the best people to answer the questions. Thank you.
Thank you. Thank you, Dr. Deborah. And we want to say to all of you that joined us today, thank you for joining our webinar, and we'll look forward to being here with you next week at the same time. Have a good week.